All right. So in the interest of time, we just have an hour today. I'm going to go ahead and get started. And again, feel free to use the Zoom features to chat, interact with us through the Q&A chat box throughout. And you can have different, I'm sure folks know this, but you can have different view options depending on whether you're full screen or not. So if you're trying to struggle with that and can't figure something out, send us a message to the chat. But otherwise, I'm sure folks are pretty versed in Zoom by now. So welcome, first of all, to our first technical assistance call of 2024. We're going to do these quarterly this year with the Impact Network, and we're looking forward to seeing many of you in Houston in our on-site meeting in May. But before that, we want to get you some content. So this will be a collaboration with Policy Research's research area. In addition to the technical assistance team, we have a group of research folks that sometimes work on MacArthur funded work, sometimes not. And today we'll be able to hear from some of that. So we'll be hearing several different presentations around the issue of pretrial bias and reducing that potential bias and some of the early intercept strategies. So with that said, I will turn this over to Sam and we'll have presenters introduce themselves as we go through. Thanks, everyone.
Thank you, Ashley. Hi, everyone. Thank you all so much for joining us on this call today to talk about avoiding bias in the pretrial period. My name is Samantha Zotola. I am a senior research associate at PRA, and I'm going to give just a very brief overview of the project that myself and today's three presenters have been working on over the last year and a half. And then I'll hand things off to the presenters who are going to share some of our specific findings and talk about their implications for practice. So I will start with our funding acknowledgement. The studies shared in this presentation were supported by the MacArthur Foundation's Pretrial Risk Management Project, but of course the authors are solely responsible for the content of the presentations. So myself and Drs. Lawson, Desmarais, and Lauder have been collaborating on about a 2-year project to look at the impact of mental illness, substance use, and race on pretrial practices and pretrial decision-making. And I wanted to give just kind of a 1 or 2 minute background on our project. We know that pretrial risk assessment instruments are often adopted by jurisdictions as one way to advance pretrial reform efforts. Usually when instruments are implemented, they are completed at the point of booking for either all or most people who are coming through the jail. And these instruments result in a risk score and often a recommendation for whether a person should be released and what types of conditions they should have. And then this score and recommendation are typically shared with the judge or magistrate, sometimes with attorneys, public defenders, or prosecutors ahead of the initial appearance to help inform decision-making at that initial appearance. And often pretrial risk assessment instruments are implemented with the hope or the expectation that implementation will result in increased rates of pretrial release, less restrictive use of less restrictive conditions, a less reliance on bail, reduced bail amounts. But unfortunately, these reform goals are not always achieved following the implementation of instruments, especially for people of color and people with behavioral health needs, who are still often disproportionately detained pretrial and are assigned bail, sometimes at higher amounts, disproportionately higher amounts. So our goal with this project at a very high level is to try to generate some knowledge that can be used to help inform pretrial practices that will really reduce rates of pretrial detention and use of restrictive conditions of release when those restrictive conditions are not necessary or not needed. More specifically, we really wanted to dig into the use of pretrial risk assessment instruments to examine predictive validity, predictive bias, and disparate impact. We also wanted to try to understand the impact a person's assessed risk, behavioral health needs, and protective factors have on the pretrial decisions that are made about that person. And we wanted to try to understand this from the perspective of people who work in the system, but also people who are going through the system, so defendants themselves. We have engaged in a lot of kind of individual studies under this larger project using different methods and with different kind of areas of focus. So you'll really see those different methods and some of those different areas of focus from each of the presenters today. And we're really excited to share this work with you all. So with that, I will hand things off to Dr. Spencer Lawson for our first presentation.
All right, thank you. Share my screen. Oh, I cannot share the screen.
Oh, I think you should be able to now.
Yep. And then Zoom start. Is it the correct screen or is it the presenter's? The correct, okay, I got the thumbs up. All right, good afternoon, everyone. My name is Spencer Lawson. I'm an assistant professor in the Law and Psychiatry program and Implementation Science and Practice Advanced Research Center at UMass Chan Medical School. So happy to be here to be presenting on some of the work that the Law and Psychiatry program has been doing around disparate impact. We'll kind of talk broadly what that is, and then get into one of the projects that we've been conducting over the past year and a half. So just as a funding acknowledgement, as was mentioned, this work was funded by the MacArthur Foundation. So any perspectives or opinions are those of Law and Psychiatry program and not necessarily the MacArthur Foundation. So to start off with, I do have a poll that I hope everyone can participate in. So I'll read it and then kind of explain how this poll is going to work. So generally, how would you describe racial and ethnic biases in risk assessment instruments today? Racial and ethnic biases are not at all evident to all the way to extremely evident. So the way that you can do this is navigate to your camera on your phone, hold your camera up to the screen. You should be given a link and that will navigate you to the poll, and then you can answer. So I'll give you a few seconds here to answer, and then we'll look at some of the results. All right, I'm gonna navigate then to the results. So it's the same process. Navigate back to your camera, hold it up to the screen. I'll be doing it as well to see kind of where we stand on this question. All right. So we only had 8 respondents answer the poll, but we do see some variability here. It looks like out of those 8, 38% were slightly evident, and then 13% were very evident. So I've asked this question before in 2 other venues. One was last week at the American Psychology, Law and Society annual conference, and then also at a Law and Psychiatry seminar here at UMass Chan. And so I just aggregated those results to just kind of start collecting maybe a broader picture. I mean, as you can see, this respondents are only 50, so obviously not generalizable to the entire population, but we are seeing some variability, on what do we think when we biases to risk assessment instruments. And the reason that I like to start off with this poll is when we talk about biases, there's layers to bias in this space. And so the 2 layers that I really want to unpack are racial bias, and then will be the focus of today's talk, disparate impact. So when I'm talking about racial bias, other terms that you may have encountered through your work is either test bias, predictive bias. If you kind of consult some of the standards for educational and psychological testing, you may have used the term differential prediction. But really, when we're using those terms, we're talking about when scores or overall risk levels for one race mean something different than for another race. When you boil down that definition, we're really talking about how does the tool function. In contrast, but still related, is this concept of disparate impact. And that is when one group is treated more harshly by the system than another group because they score higher on a risk instrument on average. And when we're talking about disparate impact, we're talking about application of the tool. So whereas test bias, we're focusing on how well does the tool predict whatever outcome. That outcome could be maybe recidivism, could be failure to appear if we're talking about a pretrial screening tool. When you jump over to disparate impact, we're really talking about the legal decision-making outcomes. So maybe the type of bond that was given, whether or not the individual was released during the pretrial period, whether they were referred to programming. So I really like to kind of situate those 2 definitions. One is talking about how the tool functions. Another one is talking about how the tool is applied in practice. So then that gets to our question of, are instruments resulting in disparate impact? That was the focus that the Law and Psychiatry program we've been kind of doing over the past year and a half. And when trying to answer that question, you go to the literature. I just briefly want to say that the evidence to date is really limited. Here is a study by Jody Villan and some colleagues that was looking at risk assessment instruments in the context of whether or not there was secure placement. And they had a variety of different questions, but one of them was really focused on disparate impact, or the application of these tools. And what these authors found, they found 6 articles that specifically focused on disparate impact. And when you kind of boil it all down, only 2 studies really found a reduction in actual disparities, so that there was some sort of beneficial impact of adopting a risk assessment instrument in their context. But at the end of the day, the authors concluded that a majority of those 6 articles really lack scientific rigor, which led them to this conclusion that there's no strong evidence for or against adopting instruments and that resulting in disparate impact. And so that's what the Law and Psychiatry program really wanted to do. We wanted to build off of this very formative and foundational work to see, can we actually have a position on disparate impact with risk assessment instruments? So through our search strategy, and I'm more than happy to talk about that at a later point, but through that approach, we located now 21 articles for inclusion. So 21 articles that were focusing on disparate impact across the legal continuum. So not just pretrial settings, but 11 of those 21 were peer-reviewed articles. So we found them in journals that the articles went through some peer-reviewed process. The remainder of the articles were either dissertations or theses, government reports, and some kind of works in progress. The types of designs that we found with these articles, once again, a majority of them were this pre-test, post-test design. And the Law and Psychiatry program really considers these pre-post designs as kind of the gold standard when you're trying to do disparate impact research. The reason for that is you can really qualify some baseline disparities. So before the tool is actually implemented, are there disparities present? And then after the tool is implemented, did that adoption impact those disparities? So it just allows you to have a more kind of robust and complete picture. The remainder of the studies, though, that were included were either just post-test design, so they were only conducted after the tool was put into place, or there were some statistical simulations, which is just really gets down to, have the tool actually been used by the local jurisdiction? Here's what they would have found. The type of risk instruments that were present in these articles. So altogether, there were 8 validated risk assessment instruments used in the articles, a majority of which were pretrial screening tools. So that is the public safety assessment, the PSA, which Dr. Desmarais will be discussing next. That represented the ORES PAT, so the Ohio Risk Assessment System pretrial assessment tool, the federal pretrial tool risk assessment, and the Kentucky pretrial risk assessment. We did have a few instruments that would be classified as risk needs assessments. So one of them being the PAC, so Positive Achievement Change Tool, the Level Service Inventory Revised, so the LSIR, and then the Risk and Needs Triage tool, so the RANT tool. One of the tools was called the Minnesota STAR, which is just a correctional screening tool for recidivism. And then the remainder of the tools included in these articles were either some sort of homegrown risk assessment instrument, or they were a pretrial tool that was part of the Juvenile Detention Alternative Initiative, which actually kind of made it difficult to tease apart what were the effects of the pretrial tool and what were the effects of the larger JDAI initiative. So just important distinction. And then the last point of kind of describing these articles is all the instruments included in these articles were actuarial approaches. So there were a list of items, you get a score, you add that up, and it gives you a total score, and then that corresponds to like a low, moderate, or high risk level, as opposed to a structured professional judgment approach to estimating risk. So what did we find? So long story short, and anytime anyone says that, they've already made the story too long. But hopefully I've kind of have not adhered to that. But what we found is there was no strong evidence of differential treatment by the legal system based on race or ethnicity as the result of risk instrument use. And just to unpack that a little further, so out of the 21 articles, 18 of them found that either adopting risk instruments had a null effect or had beneficial impacts. So it actually reduced disparities. And so looking at those 18 articles, you can kind of see these two camps, null effect and beneficial impact. So 10 of the articles we would classify as a null effect. So either the risk instrument, using the risk instrument did not lead to the creation of disparities in legal decision-making, nor did it worsen existing ones if, for those types of studies, going back to that pre-post design, there were already disparities present before the tool was adopted. And after the tool was adopted, it didn't reduce the disparities, but it also didn't exacerbate those pre-existing disparities. And then out of those 18 articles, 8 of them actually had some sort of beneficial impact on observed disparities and outcomes. And a majority of those outcomes were pretrial outcomes. So whether we're talking about pretrial release or the use of non-financial bonds, release on recognizance, a majority of these articles were kind of in that pretrial space. Now, I always couch this conversation into what has been highlighted on the screen. So the law and psychiatry team did look at methodological quality and scientific rigor of these articles. And we rated the articles on a tool. It's called the quality assessment tool. And as you can see, a majority of these studies were rated as either weak or moderate on that methodological quality tool. So it's just really important to, when I'm talking about these findings and the conclusions, to always just kind of couch that within this methodological quality kind of caveat to these studies. And then, so that was 18 articles that found either null effects or a beneficial impact. And the remainder of the study, so 3 articles, actually did find a disparate impact. So one of them used the LSIR, and this was actually in the opposite of the hypothesized effect. So what these authors found, which one of them is presenting today, they found that white probationers with low risk scores received longer sentences than Black probationers with similar risk scores. And then the other 2 articles that found disparate impact was in the hypothesized effect. And those 2, one of the articles used the public safety assessment, so the PSA, and the second article used a homegrown risk assessment instrument. And they found that heightened racial disparities with Black individuals facing harsher legal outcomes relative to white individuals due to the tool use. And those outcomes, one, as I mentioned, was the PSA, so it was kind of pretrial release. And then the article that used a homegrown risk assessment instrument was focused on a sentencing outcome. So kind of taking a step back, what's kind of the big takeaway? What's the implication for you all in your work? To date, the evidence does signal that risk instruments are not resulting in harsher treatment for individuals with minoritized racial and ethnic identities. We're not seeing widespread evidence of disparate impact with the use of risk assessment instruments. A couple points that I like to highlight is, one, just as you are having these conversations within your local jurisdiction, adopting and implementing these tools, we really need to make sure that we're only using instruments that have been locally validated by race and ethnicity. So we're talking beyond just predictive accuracy. We're going back to, we're looking at predictive bias across whatever identity that we're interested in, whether that is race or ethnicity or gender. And we're talking about disparate impact. And that latter one, as kind of the point of this presentation, there has been less focus on disparate impact work. And then also risk assessment. What is the goal of risk assessment instruments? They are to inform decision-making, not to usurp or to replace decision-making. And I think a lot of the presenters today will kind of be highlighting that. So just really focusing on what is the goal of these tools. It's not to predict. It's around prevention and mitigation. We know that we can't predict human behavior with 100% accuracy. And really, when you look at the evolution of risk assessment instruments, those like second generation tools, that's really what the focus was a statistical authority, finding the items that have the that were most statistically significant with whatever the outcome was. But then as you moved into those third and fourth generation tools, that's when we started seeing the introduction of dynamic risk items being added to the tool. So those changeable items. And we started seeing these tools being incorporated into case management plans to make sure that the most appropriate treatment services and risk reduction services were being used. I think I'm running kind of close on time. My time is covered up here, but my last slide here, focusing on kind of what are our next steps. One, just making sure that we're enhancing methodological quality as we continue to do this disparate impact research. Two, increasing the diversity of disparate impact research. A majority of the work has been done in the pretrial space, which I think is a benefit to you all that are attending this talk. But we need to make sure that we're extending beyond just pretrial outcomes. And the type of tools. So most of these were actuarial tools, so incorporating structured professional judgment tools. And then another is the types of groups that were engaging with this work. So majority of the work was looking at Black-white comparisons, but making sure that we extend to Latinx groups. And what Dr. Demaray is going to be talking about is Indigenous peoples. So I think those are some next steps that we need to make sure that we have at the forefront of our mind when conducting this type of work. Developing a common nomenclature, making sure that we're speaking the same language. Only 5 of the 21 studies that were included in the systematic review actually used the term disparate impact. So I'm not going to advocate for one word or another. It's just making sure that we have these conversations and make sure that we're speaking the same language. And then always just addressing implementation issues. I always like to highlight the education aspect of this, making sure that we really understand, both researcher and practitioner, what is the goal of implementing and adopting risk assessment instruments within your jurisdiction. So I thank you for your time, and here's some of my contact information and one of my collaborators, Dr. Gina Vincent, and I will now hand it over to Dr. Demaray. Thank you all for your time.
Thanks, Dr. Lawson. So as Spencer alluded to or introduced, I am going to be talking about a study focusing on really establishing predictive validity and testing whether there's bias in the PSA, specifically within Native American people. So first, I want to acknowledge all the various co-authors on this work, including someone who is well known to the Impact Network, I'm sure, Liz Hassett. So I love going after Spencer because he's given you the highest level overview of the entire literature. And I'm going to touch on the sort of 2 things that we were really particularly interested in addressing as gaps that we saw in the pretrial space. So we're going to be focusing today in this presentation on that idea of racial bias. So if scores mean different things for different groups. Really overall, as Spencer already kind of mentioned in relation to disparate impact, but the same thing can be said in racial bias. In fact, despite a very common narrative, we see very limited evidence overall that there is racial bias in pretrial risk assessment instruments. Now, the caveat there is that most of this work has been done with Black, Hispanic, and Latinx people. So we wanted to expand this focus with this particular study to focus on another minoritized group of individuals, Native American people. We don't hear as much about it typically in this conversation, but Native American people are overrepresented in US jails. We see double the incarceration rate of white people. There are historical contexts and factors that really play into and contribute to these disparities, including distrust of the system and historical harms. And while we have seen, there's a really great new study that just came out looking at risk assessment and testing for racial bias as a function of Indigenous peoples in other risk assessment contexts. So outside of everything basically but pretrial, there, to our knowledge, is no research or evaluation within the pretrial context for looking at bias as a function of for Native American people. The other thing I wanted to talk about is that a lot of the work in the predictive validity literature, again, in the whole field, but also specifically in pretrial, has really been focused on evidence from larger urban areas or mixed areas or entire states, where there's a predominance of a focus on how things work in kind of metropolitan or larger urban areas. But we know that in a lot of contexts, pretrial, probation, and otherwise, there's a lot of unique barriers and facilitators to success. And some of the ones that I'm mentioning here just in passing around transportation or services, lack of cell coverage, could be reasons why what we think of as factors for, let's say, failure to appear might not be the same factors that we see in these rural areas or these more rural areas. On the flip side, there's advantages of being in these smaller communities because there's often less bureaucracy, more familiarity with people, and maybe some kind of more hand holding and kind of grassroots efforts to help people be successful. So for those reasons, we continued work with Pennington County, South Dakota. And this has been a long-standing research partnership, and we really together came to this idea of examining what was going on in the pretrial space in their community. So for those who aren't intimately familiar with Pennington County, it is the second most populous county in South Dakota, but there's a high degree of rurality. And that number there, just only to share that it takes into account not just census tract kind of information, but also just degree of difference and distance, to various resources and neighbors. Important for this study, it is neighbored by 3 of 9 tribal communities. And we know from the community level population data that Native American people make up 10% of the county, but about 50% of the jail population. So definitely just reinforcing the overrepresentation in incarcerated communities or populations. Now, many of you know that Pennington County implemented the PSA in 2018 as part of the SJC related efforts to reduce detention rates and improve racial equity. So today I'm going to talk about PSA scores in about 4,500 people, pretrial cases, who were released on their own recognizance in Pennington County. And the 2 findings I'm going to talk about specifically is just its predictive validity overall. So did it predict the things it was supposed to? And then to compare performance for Native American and white people. So I wanted to just share for those of you who aren't intimately familiar with the PSA, just very briefly, that this is an instrument completed without an interview based on records. And it is one of those what Spencer called actuarial tools. So you rate the items, you sum up the total score, it is scaled and it relates to levels of risk from 1 through 6, 1 being lowest risk and 6 being highest risk. There are 9 items that are coded in following a manual that's publicly available at the website I provide below. For failure to appear, it considers 4 items focused largely on the current charge, prior conviction, and past failures to appear. So what we would call static or historical unchangeable factors. Oops. And then the second scale is the new criminal arrest scale. There's a third scale, the new violent criminal arrest scale, but we did not have outcome for that particular scale. So we're going to focus today on these 2, the FTA and the NCA scaled scores. So overall appearance rates, I'm going to be presenting here overall. It was about 2/3 were successful in appearing for all court dates during the pretrial period. And then I'll show you what is not supposed to happen. So here we should see at level 1, the most success, and at level 6, the least success. And so this, and it was borne out in the statistics, that this really shows not very good prediction of failure to appear or appearance rates in Pennington County. In contrast, the NCA scale performed very well, and this diagram looks exactly as it should. More people remained arrest-free at level 1, fewer people were arrest-free, or more people got arrested at level 6. So now we can move into our comparison as a function of race. So overall, about 60% of Native American people appeared at all of their court dates. And what you can see here is a trend in the wrong direction. So they were least likely to appear at lower levels of risk and more likely to appear at higher levels of risk. And so here, it was really not predicting appearance rates very well at all, even worse than in the overall sample. For white people, however, we saw a much more predictive validity, much better outcome, where we saw exactly the way it should. More white people were showing up when they had been rated as a low score versus a high score. So this is concerning and a problem. Now, moving on to the arrest rates, here we actually see very little evidence of differences in predictive validity, and frankly, very good predictive validity overall. So the NCA scale worked very well in predicting arrest-free rates amongst Native American people, and similarly worked well for white people. There was a little blip on the level 5 there, but it was still trending in the right direction. So what does this mean? The first thing we know is that the PSA is implemented all over the United States, and we're really wanting to emphasize and support, kind of call to action, the importance of local validation. Just because a tool has worked well in one community does not necessarily mean it will work well in another, especially one that is distinct from those communities in which it was validated. Our hypothesis, and working with the county on this, how to move forward, is really that the factors are not taking into account the reasons that people are failing to appear in court in Pennington County, a more rural community, where they're also doing a lot of great work around reducing FTA rates. So I think it's both a function of their work through the SJC funding to improve appearance rates, and also that when we do say failures to appear, is not for the reasons that are currently captured in the instrument. And we actually did see very limited evidence, in fact, no evidence really of predictive bias or racial bias for the new criminal arrest scale. So there is good support for continuing to use that scale overall and within Native American people specifically. So with the last sort of few seconds I have left, I wanted to just encourage a conversation that we as a team have been looking at, and in fact leads nicely into our next presentation, where we're looking at other factors and thinking about those factors that can change. One of the real selling points of the PSA is it's focused specifically on static factors that can be pulled from our official records. But it also means that we aren't providing any information or factors on things that can change. And then even more critically, that we're not looking at people's needs. So what are the things that we could support and address to improve their success, particularly as it relates to failure to appear? So with that, I forgot to introduce myself. I am the president of Policy Research Associates, and I will be passing it on to Dr. Evan Lauder.
Thank you, Sarah. Thanks for that great transition. My name is Evan Lauder. I'm an assistant professor in the Department of Criminology, Law, and Society at George Mason University, where I also direct the Early Justice Strategies Lab. And today I'm going to be talking about the work that myself, as well as several members of my research team, have produced, where we have looked at defendant perspectives on their own risks, needs, and strengths during the pretrial period. So funding disclosure, of course, this work was funded by the MacArthur Foundation. The conclusions are ours alone. I want to start off by providing some background for those of you who are unfamiliar with the context in Indiana, where this work was performed and where my team has really been, central to evaluating Indiana's pretrial reform efforts. So between 2015 and 2016, a set of counties in Indiana began implementing Indiana's version of a pretrial risk assessment tool, which, if you're familiar with the ORAS PAT, developed and used in Ohio, it's basically the same tool. And so there were 10 counties that began using this tool, and then later on there was kind of a statewide implementation of this tool. And so my team has really done, several evaluation studies looking at the performance of, risk assessment guided decision-making in the pretrial context. One of the first studies that we did looked at the predictive validity of risk assessments, and we found overall that risk assessments showed good evidence of predictive validity. They produce, good accuracy in predicting pretrial misconduct outcomes. However, and a nice transition from Dr. Demaray's presentation, we found that these assessments were less accurate for Black defendants in particular. When we looked at the implementation success of the risk assessments on actual pretrial misconduct outcomes in the community, what we found is that defendants who had risk assessment guided pretrial release decisions actually had higher rates of non-financial release. They were released on their own recognizance, but we also found that these tools had less impact on pretrial misconduct. In fact, we found that risk assessment guided decisions were actually associated with a slightly higher rate of rearrest. And this runs counter to the R&R model, where we, posit that individuals who, get assessed at higher risk and get kind of, more intensive resources as a result of that, or more intensive intervention, that we should see that there's some sort of kind of curtailment of their risk in the community. That's the risk principle. And indeed, we don't see that. And so, one of the things that our team has done is kind of, shift our thinking a little bit towards thinking more about needs and responsivity. In one study, we looked at the effectiveness of risk assessment guided pretrial supervision. And in that study, we found that individuals who were placed at higher, kind of more intensive supervision monitoring actually had worse outcomes in the community. So this has really shifted our thinking to try to understand, okay, well, what are the factors that could actually help, inform strategies that could be more effective for people who are on pretrial release. So this brings us to the current study, where we have started to try to understand how defendants themselves perceive their own risk and protective factors during the pretrial period. And in particular, we've been interested in exploring differences in those perspectives across Black and white defendants to ultimately get us to this goal of potentially informing some equity-minded pretrial interventions that would actually help, reduce pretrial misconduct and do it comparably right across different racial groups. So our approach, we conducted surveys and we conducted interviews. So I'll talk about the surveys and then I'll talk about the interviews. But essentially what we did is we recruited pretrial defendants across 10 different local pretrial services agencies, local counties in Indiana. We had 256 respondents. You can see on the right an example of the survey card that defendants were given. So they were given kind of a QR code, unique login information to be able to take the survey. We oversampled in diverse jurisdictions. So we wanted to kind of increase the racial diversity of our sample. And this survey was delivered online, and we collected data between October 2022 and November 2023. Among those participants who participated in the survey, we recruited them to participate in follow-up interviews. So we conducted follow-up interviews with 75 participants. And you can see on the left our response rate based on those who took the survey across different racial groups. So I think this is important to note that, we didn't have a huge kind of racial representation in the survey. We originally wanted to get kind of 25, racially diverse defendants that were female, and then 25 that were male, and then 25 white defendants and 25 white white female defendants and 25 white male defendants. We were unable to hit kind of the quota for a more racially diverse group just because of the, the population, I think, that is present in Indiana and in the counties from which we recruited in particular. However, we did our best to, ensure that folks would feel comfortable talking to us. We did a training with a correctional psychologist on trauma-informed interviewing. So that was really helpful in, ensuring that we could establish that trust with individuals during the process. And we collected interview data between October 2022 and October 2023. Here are the measurement domains that were the focus of both the survey and the interview. So we asked defendants about their perception of risks and needs that were important during the pretrial period, what strengths would help facilitate success on pretrial supervision, their perceptions of risk assessment, and their perceptions of the criminal legal system more broadly. For today, I'm going to focus on those first two measurement domains. Here's a brief overview of the gender demographics of our samples, and I compare these to the Indiana criminal legal population. So the population we're comparing to here is everyone who has been charged with a crime in Indiana. And you can see that, of course, in this sample, women were slightly more overrepresented. I think that probably just reflects, greater comfort and willingness to speak with us. When we look at the racial distribution, pretty good representation of white defendants relative to the Indiana criminal legal population. And what you can see here is this weird shift between, the proportion that we identified that were Black or African American and those who identified as something not listed. So here, right, but other racial and ethnic identities. And I think that reflects that we likely asked about kind of a more diverse group of identities that people could, endorse, right, relative to, what is typically asked from criminal justice agencies. So getting into the risks and needs, we asked about a whole host of risks and needs, and I'm really asking about things that would be challenging for people who are on pretrial supervision to be successful in the community. And of course, a big focus of this was looking at differences across racial groups. And so for the purposes of what I present here, we focused on Black and white defendants just due to the very low representation of other racial and ethnic groups in our data. And so here you can see the results of risks and needs by race. So there were 5 different risks and needs factors that showed up as Black defendants endorsing that these were more challenging relative to white defendants. And these were police stops, lack of needed services, having over-policing in the neighborhood, having a prior history of incarceration, and not having a high school diploma. So having that kind of educational deficit. And in interview data, we saw these themes come out. So this is someone, a Black man, who is talking about, the experience of getting profiled by law enforcement. And you just see me pass and I'm following all the legal traffic procedures and everything, and you pull me over. And this is kind of contrasted to, white defendants. This is a white man who's talking about, the jail system more in terms of being kind of profit driven, right? So less focused on kind of those factors kind of leading someone to get into the jail, but more focused on, their perception of the system. So they want to keep me there. It's all orchestrated and profitable. And here's a Black woman, making a distinction between officers who have been helpful versus officers who not just want to throw you in the back of the police car because you're on the south side of town, right? So she's kind of, acknowledging that like she's experienced, disparate policing because of her race. So we also asked about strengths. So these were asked about in terms of what are things that you think would be helpful to someone on pretrial supervision to help reduce rates of pretrial misconduct. And again, here we asked about a lot of different things, and there were factors that showed up as showing differences across racial groups. And again, it was Black defendants who were who rated these things as being more helpful relative to white defendants. And those were having collaboration skills, making enough money to, survive basically on pretrial release, having someone in your life that you can trust, being able to meet the pretrial services officer online, so as opposed to going to in-person appointments, and then being able to go to school during the pretrial period. And in interview data, this is a man who's talking about, the fact that he is basically working overtime. So I got bills to pay. It's kind of hard out here. So I do what I need to do, which is work, right? So really talking about that need to have sufficient financial resources during the pretrial period. Here's a white woman who, conversely is talking about kind of that, the flexibility and, ease that, she experiences during the pretrial period. So luckily I work for myself. I'm pretty open as far as it doesn't affect me as much as somebody else that has happened to get there. And I have transportation too. So, it could really be a hindrance on some people that don't have that, So she's talking about, specifically being able to go in for, in-person visits with the pretrial supervision officer. Here's another Black man who's talking about the role of a support system. I was glad to try to get a good support system of other people that might be able to help me do things that I wasn't going to be able to do. So I tried to contact people that could help me out in times whenever I couldn't get something done myself. And finally, here's a Black woman and a Black man both talking about the difficulty of having to report in person and basically reflecting on the ease in which the virtual appointments really help them out in their lives. So last thing I want to talk about is we did ask about behavioral health needs. These were asked via kind of structured assessments. We used the CAGE aid for drug use and alcohol use and the brief jail mental health screen for mental health, just to get a sense of kind of what the needs were in the sample. And you can see really no differences except for with endorsement of mental health, where white defendants were much more likely to, endorse having mental health difficulties during the pretrial period. And I think this is reflected in some of the quotes. So, this white woman and white man, she's talking about, I was under the influence of drugs and I made decisions that I did, so I wasn't thinking clearly. Kind of this individual, thinking about the role of, substance use in someone's success in the community. And similarly for this white man who says your decision-making truly isn't who you are, like you become a whole nother person, and you and your decisions are not moral based. And we contrast this with a Black woman who talks to us about kind of all these other ancillary problems that are happening in the lives of individuals that then results in, drug use or challenges with mental health. So she says a lot of people face everyday problems with not having family or friends and a place to live, transportation, food to eat. And the only way that they can escape that is through drugs, or maybe because that's what their mental statement is telling them. So I think reflecting on these findings overall, there's a few things that, come up for us. One is that, I think there is something to be said for being able to understand unique risks, needs, and protective factors or strengths from the defendant's perspectives by race. So, it's clear from our data that, endorsement of these things that would be challenging or would be helpful to people seems to have some racial differences, and that we see this reflected in some of the commentary that people have told us when we're having kind of this conversation about their experiences during the pretrial period. Another thing that seems to be a theme here is understanding kind of the role of relative disadvantage and structural disparities in both, in the lives of people of color, but also how they inform their likelihood of being involved in the system, and being able to kind of account for that in risk assessment driven decision-making could have very, big implications for how those tools are used, the fairness associated with those tools, and how, we're able to use risk assessments to actually help people during the pretrial period. And then kind of associated with that, being able to use risk and needs assessment practices with an equity lens in mind. So we are, interested in thinking about, how some of these findings might inform kind of needs-based interventions, especially those that are voluntary, that can help connect people to the services and supports that will help them be successful during the pretrial period. And with that, I will conclude my presentation. If you are interested in hearing a bit more about our work, you can go ahead and scan the QR code. And we have kind of a brief report of some of our findings that we've produced for some of the local agencies that have worked with us. Thank you.
Thank you, Dr. Louder, and all of our presenters. I'd like to open up the phone lines, the virtual phone lines, for any questions, or I don't see any in the chat, but feel free to use that. In the meantime, I just want to touch on a couple high-level takeaways and underline those. We talked about the importance of validated risk assessment tools and just screening and assessment tools generally. So we know that we're looking at what we think we're looking at, but also exploring local validation depending on tools and where folks are. We also talked about that our goals are informing, but not usurping or replacing decision-making when we talk about this area. And then finally, with Dr. Louder, considering defendants' perspectives on their own risk and protective factors, which is really consistent with what we talk about all the time and promote around the folks with lived experience and their voices in designing and evaluating and implementing programs. So any questions, if anyone wants to unmute, we've got a couple of minutes for that. Otherwise, we'll give you time back. I don't see any. So if not, I'll give you a few minutes back. A huge thank you again to our presenters who fit a lot in a short time. And we'll see many of you in Houston in May, and we'll have our next technical assistance call following that. So we'll see you all soon. Feel free to email us for contact information as well. Thanks, everyone.